I am Pete Meitzner, currently the chairman of the board of the Sedgwick County Commission, which also serves as the Sedgwick County Board of Health. With me today is Adrian Byrne, the Sedgwick County Health Director. Today we learned that Kansas Department of Health and Environment did confirm with our Sedgwick County Health Department a presumptive positive case of the COVID-19 in a Sedgwick County resident. Our Health Director, Adrian Byrne, has some additional details.
The patient is a female over the age of 60 and is currently isolated in her home. She was tested due to fever, cough, and shortness of breath. We quickly contacted her, the people that were around her, and they are self-quarantining, and we will be monitoring their symptoms. So it's important, as it always has been, to maintain social distancing and to practice good hygiene, not only for the health of each individual, but also the health of the community. We appreciate KDHE's quick turnaround with the testing and just learned this evening of that positive test.
So with that, we knew that eventually we were going to have a positive case, and now that's happened. Now more than ever, the health and safety of our community continues to be a top priority. We continue to rally together to stop the spread of this disease. This social distancing and practicing of good hygiene, I can't stress enough. We're responsible for the health of our community, all of us, especially the health of our elderly residents and those that are at risk. So we've done a lot of planning. I'm very happy that the plan came into effect, immediate contacts with those affected or around the affected person. And so I hope that the community feels comforted that these plans are in place and they're acted on immediately. And that's what we will continue to do. And we continue to encourage our citizens to just be self-aware. And it's not something that we want to create a panic. We are a large city, the 49th, 50th largest city in the country. We've been a blessing that it's not happened earlier. Most of the other cities have it. So we now have it. We might or probably will have another. And so thank you for the community and all of our businesses to continue to support all the things that we've been talking about. So with that, we'll stand for a couple of questions. The question was, what is the timeline of events that happened? I'm not, but Adrian will handle that. Thank you.
So the patient wasn't feeling well this afternoon, yesterday, went to their physician, was tested. The test results came back shortly after 5 o'clock, and we got that information about that presumptive positive and contacted the patient and got the information about her close contacts, and then quickly contacted her close contacts.
And we believe she got this from some sort of travel, or?
That is still being investigated at this time.
Did she say how long she's been experiencing these symptoms that she came forward?
That is not information that I have. So the question was how long she had been experiencing symptoms, and that is not information that I have.
Any idea of places that she may have been to here locally where people may need to be concerned or follow up with?
No, that information, from what we know, there were individuals that she was around that weren't in areas where people congregate. And so at this point, there's no concern over notifying businesses of people needing to contact us to be monitored.
And just to be clear, those symptoms didn't start until this afternoon?
I would imagine that those symptoms were there prior to yesterday, but that is when she went to her family physician to talk about how she was feeling and her symptoms, and then the samples were taken and then sent to the lab at our state health department in Topeka.
I guess where do you guys go from here with all this?
Well, where we go from here is that since we have already contacted the small number of close contacts that this person has had, we will be monitoring them for symptoms in the next 14 days. And if they develop any symptoms, then they would be tested, and we start the process over again as far as waiting for those results to come back. But at this time, they are quarantined, and she is isolated in her home, and her physician will be monitoring her symptoms.
Without giving too many specifics away, as far as people who are in close contact, are these people who all live in the same dwelling, or are we talking two different dwellings?
I don't have that information, but I believe that they were friends outside of where she is. But they've been contacted, and at this point, they'll just monitor for the next 14 days, and if they experience symptoms, they're tested. If they're not experiencing symptoms, then at the end of that 14 days, they'll go about their life again.
Do you mind restating the symptoms that you said she was feeling?
The standard symptoms that she was having that's also needed to be considered at risk for testing is shortness of breath, a fever, and then a cough.
And I know experts have been telling people to contact their physician first before coming into a doctor's office or coming into a hospital. Any idea of the situation? Was that kind of, did her physician know that she was coming in with these?
Yes. She had contacted them beforehand.
One more question.
Yeah, chance to keep over here. How many people do we have the capacity to test at this point?
The testing supplies are on short order and access all over the country. So how many people can we test from the hospitals? I don't know how much supply they have, but they are able to test as we are by appointment, going through right now as of tomorrow. 211 will be able to triage or take calls and screen, and then they will give them, pass those calls on to us, but they are not ready to handle any of those calls as far as having medical people there until tomorrow morning.
Okay, and I will remind you that Sedgwick County, we've implemented that we want to do daily press conferences or daily releases at 11 o'clock on at least Monday through Friday, and maybe the weekends if necessary. So tomorrow at 11 o'clock, we do have a Sedgwick County meeting, a board meeting at 10 o'clock, and hopefully that'll be over before 11, and then we will have our video update, so we'll have a little more information, probably a lot more information at that time, and you're welcome to attend the video. Not sure how much Q&A will go on because we try to keep these live to the 5 and 10 minutes, but we will be there and be available depending on what else we find out. So thank you again for covering this, and we will move on as a city and a county. Thank you.